Hey, good evening, everyone, and welcome back to one more live. And we've got an interesting topic this time, and the topic is sleep. And we've got an interesting guest as well on live today. He's Dr. Abhinav Singh, and he's the medical director of Indiana Sleep Center. He's the assistant professor at Marian University, medical reviewer for National Sleep Foundation, and a distinguished fellow of the American Academy of Sleep Medicine. I actually happened to meet him by chance because my son was joining college in US and I was looking around for some kind of a reference there, and I have very close friends, Naveen and Sriram and Sarita, all three of them being singers with a band called Dhwani. And they've performed a number of times in Indianapolis. And they said, we've got a friend there, and you know what? He's a sleep doctor. And I had no clue what a sleep doctor is at that point in time. Of course, we met, we became friends, and that's the whole story. So, cutting it short, sleep, the Dalai Lama said, is the best medicine. Someone else said that your future depends on your dreams, so go to sleep. Easier said than done. I'll just check if he's come in. No, he hasn't come in yet. Easier said than done. Try telling someone who counts sheep every night, trying to go to bed. And if you look at the other side of the coin, someone said there are 12 hours in a day, but about 50 in the night. Someone else said, if a man had as many ideas during the day as he does when he has insomnia, he'd make a fortune, and very correctly so. I'll just take Dr. Abhinav on the call. Hey,
Hi, how are you, Rajiv? Good to be
I'm
with you.
doing good. Good morning to you and good evening to everyone else.
Yes.
So I was just telling everyone some quotes here that if a man had as many ideas during the day as he does when he has insomnia, he'd make a fortune. And honestly, when we kind of stay up in the night is when all the ideas, start to come. And in fact, someone else said, the only time I have problems is when I sleep. As if everything seems to come together and all the problems, all the ideas, all the negative thoughts in your head start to pour in, when you can kind of try and go to sleep. So let's kickstart today's discussion because we've got a whole lot of questions and 50 minutes to kind of try and finish all of them.
Yes.
Abhinav, how would you simplify the sleep cycle for everyone? I mean, what is the sleep cycle?
Yeah, the sleep cycle is an interesting phenomenon. It's complicated. It involves the brain and body. So imagine the sleep cycle like a giant washing machine for your entire body, right? So getting rid of the waste products that have accumulated through the day, rewiring some of the brain connections that you've absorbed information from to different parts, refreshing your aching muscles, getting repaired. So they happen in about 4 or 5 cycles, just like your washing machine, right? Rinse, wash, soap, hot water, cold water cycle, rinse. It does that, and you cycle between two different sort of, we call non-dream and dream sleep, about 120-minute cycles, and they last about 7-8+ hours. So 4 of these 120-minute cycles takes you to about 480 minutes, and this happens every 16 hours of your living life from day zero to day end. It's like your maintenance.
Right. So basically, sleep is all for maintenance. And you mentioned 480 minutes. Is that something which is an average? I mean, again, people say, I sleep 4 hours, I sleep 7 hours, which is good, which is bad.
Got it. So it's a good question. It's a rough yardstick. It's not for everyone, but over the years, about the last 30-40 years, we've figured out that between 7 and 9 hours will fit most. Anytime you hear someone saying, oh, I just need 4 hours, doctor saying, oh, that's all I need, I'm fine. Well, they are not. So science has shown that on the weekends, they will capture, when they can sleep in, they will try to compensate. They will be drinking extra coffee through the day. They'll be angry. They'll be irritable. They'll be forgetful. They'll be compensating in some way. So it's like, you opened your washing machine door at 4 hours instead of 7. The clothes are still wet. They're somewhat clean, but not all the way.
Right.
That's the point here.
Right. So what happens when one is sleep deprived? What starts to go wrong?
Yes, so little bits of everything. So sleep deprivation is probably the biggest pandemic hiding behind the pandemic that we are in right now. Chronic
Right.
sleep deprivation. You're cutting short your cycles. Just imagine that, right? You needed 6 or 7 hours to, let's say, bake a cake or complete cooking a biryani, or think about anything that takes about 7 hours to do, and you are wanting to do it in 5. Think about pregnancy. You are the
Right.
fertility guru, right? Can you compress the human pregnancy into 7 months or 6 months and get and reliably a
Right.
good child, healthy baby? So the short answer
Right.
is probably not. A lot of trouble takes place. Sleep deprivation has been linked to heart diseases. Sleep deprivation has been linked to anxiety, depression, weight gain, appetite issues, irritability. I can keep going. There's a whole list of things that you will feel as other diagnoses, but often are tracked back to chronic sleep deprivation.
Right. So the clothes are going to come out dirty and not so dry.
Correct. And who wants to wear those, especially in
Yeah,
humid
true,
summers right now?
true, true. Another question which has come forward is, why do we dream? And is it something that is there in the subconscious? Is what we see in our dreams? Is that true?
So it's a difficult question. Dreams were discovered in 1952. Dream sleep. Let me correct myself. 1952 is when we discovered what we call rapid eye movement sleep. It's the stage of sleep where we are dreaming vividly and we recall these dreams. We are dreaming in non-REM sleep as well, but we just don't remember them. So what do these mean? Psychiatrists, psychologists have pondered over this for over 100 plus years, because this is your creative unleashing. You think
Right.
about things that are not in your social context: flying, falling, jumping, chasing. And then you get up saying, oh, I met so and so you've not met for 30 years in dream. What do they mean? Do they signal something? We don't fully understand that yet. Dream content is a subject of research, whereas dream sleep itself physiologically has certain meaning with memory consolidation, and therefore, so there is a bisection here of what does the content imply, meaning are you afraid, depressed, fearful, and what does the physiology imply, which is REM sleep, which is required for
Right.
memory consolidation and emotion management, etc., and growth and repair.
But would we classify someone as normal or abnormal based on whether they dream or whether they don't? Or does everyone dream, even if they don't realize it?
Perfect. You said it. Last line is worth gold. Everybody dreams. It's just how many times do you remember it is where people fight over and debate. Oh, I didn't remember my dream for
Right.
5 months. Now that's a problem. In a week, typically people will remember their dream maybe once or twice. And it's usually the last, hour of sleep where you get up and you say, oh my God, I was in
Yes.
Switzerland. I was in Kolkata. I was eating puchka yesterday with my, bodhi or something like that. You'll remember. But you're sleeping, right? And then people want to go
Right.
back to finish their dreams. So once a week is probably okay, twice a week to remember. But if you've gone on for months and months and you've not remembered a dream, then maybe your dream sleep is being interrupted and you want to get that looked into and speak to someone about it.
Right. Dreams versus hallucinations. Is there a difference? Are they same? And how different, if different?
So they are different. It's a little bit of terminology here. So dreams are physiologic. All of us do get them: dream, sleep, and dreaming. When this becomes negative and fearful and associated with negative connotations, then we start to call them sort of hallucinations or nightmares. So nightmares are still a part of sleep. Hallucinations take place at the edge of sleep and wake many times. So when you're just falling asleep, you may see an image or hear something. And then when you're just waking up, you may be finishing a part of dream, but that starts to become a little more negative. Hallucinations often
Right.
go in hand with some psychiatric diagnoses at times, especially auditory hallucinations when you're hearing things that are not there. That starts to take you into a little more of a psychiatric problem. Whereas visual hallucinations can be a sleep-wake interface issue.
Okay. Now, with modernization happening and a workforce being in India, the actual industry being in the US, people are working night shifts, BPOs, etc., and that's kind of generating a whole generation of people who are doing that. Maybe even as simple as a night guard. Is it normal for people then to stay awake during the night and then come back and say, okay, I will sleep during the day and I'm still getting my 6, 7 hours of sleep? Or is that something abnormal? Does that generate or cause medical problems in the long run?
Yes, so we've become addicted to this 24/7 culture, right? Since the light bulb was invented, the Industrial Revolution took place, we've become this ever connected, always on society. And you're absolutely right. The world is shrinking. folks across the world are working at different hours. So let's step back. We are all solar animals. Our design as humans are to be up with the sun and down with the moon. Whenever we try to tinker with nature's design, you know what happens, right? It never ends
Right.
well for whoever is trying to mess. Now, having said that, yourself and myself being, physicians and having trained through the process, we've all had sleepless nights and, 36-hour,
True.
40-hour shifts. Never good on the body, and especially chronically long term, they have a lot of adverse effects. So let's say your shift is 8 p.m. to 8 a.m. or let's say 7 p.m. to 7 a.m. You are messing with the body's physiology. When it's dark out, you are programmed to sort of switch off and shut. Now you're working against a resistance here that your natural design is telling you to do. So imagine driving with the handbrakes on. Okay, imagine you're driving in your
Right.
wonderful car, but the handbrakes are on. Will the car drive? Sure, it'll drive. But you're going to consume a lot of resources to get that done. So it's been shown that shift workers don't sleep enough. Even their 6-7 hours are very interrupted because guess what? 90% of the world is awake at that time, right? Wherever they are.
Right.
So doorbells, messages keep buzzing. No matter how much you can cocoon yourself, you will be interrupted. And those 6 hours or 7 hours are just not the same as the nighttime synchronized 7 hours.
For sure, I know the people who work night shifts, and research has shown that they have more incidence of fertility,
Yes.
rather infertility. So that I know for sure because that's my department. And I'm
Yes.
sure other diseases, cardiac disease, and all the other problems must also be on the rise. Now, coming to insomnia, how does one go about treating general insomnia? Someone is just having difficulty in sleeping. How does one go about looking at that? Of course, I will
Correct.
be asking you good habits about, before going to sleep, so we'll discuss that later. But how does just one generally treat this bit?
Yes, so insomnia as a symptom, insomnia as a diagnosis, right? So
Yeah.
insomnia as a symptom, guess what? Has a lifetime prevalence of 100%. So let me say that
Okay.
again. So insomnia as a symptom is going to be experienced by nearly every one of us, but it's not a disorder yet. When you have more than 3 times a week interruption of falling and staying asleep difficulty, and this is lasting for 3 months, that's when it starts to take a shape of its own as a disorder. Insomnia is typically precipitated by something, so a stressful event, a a life event, a spousal discord, a loss, a death, a job change, a bad boss, something precipitates the insomnia, and then that stressor goes away, and now you develop this habit of stressing about something around bedtime, and you talked about it in your question, anxiety, and that can perpetuate insomnia. How do we go about addressing this? So first things first, we can't do anything about the precipitant. It has come and gone, right? Whatever sparked off your
Right.
insomnia is already come and gone. What we do target with insomnia is behaviors, how your mind has now become um, conditioned to fighting sleep or trying very hard, because these insomniacs come evening and night start to worry about their sleep. Oh God, it's been 4 bad nights. Is this going to
Yes.
be a good night? They start looking at their watch, they start looking at their app, they start turning the screens down, they tee themselves up, they start picking up a sleepy tea, they look for this. So it all becomes a stressful event for them. And it's not supposed to be. You see children how they sleep. They will sleep in a rock concert. That's how
Right.
powerful the sleep drive is supposed to be. So they have developed this resistance. We go about behavior change first. Medicines for sleep are probably the single most, what I say, wrong first step. I'm not saying they're not useful, but they are not the best first step for long-term resolution of insomnia. And we can talk at depth about, at another time for this because it's a longer discussion.
Right. As you and I were discussing, we probably need a full podcast for this. 50 minutes of Instagram live really doesn't do justice to a topic this deep and this vast. So you would say probably there's some sort of a vicious cycle which works where you start wiring your mind to say, I'm not going to be able to sleep, and probably that's why you don't land up sleeping as well, because you're kind of subconsciously telling yourself that you probably will not sleep because of all that which has happened previously.
Correct. So, trying harder makes it even harder. So there's a
Harder.
colleague of mine, Daniel Erickson and Michael Granna here in the US. They say, the harder you try, the harder it gets when it comes to falling asleep. So don't.
Right.
The less you try, the easier it gets.
So someone in fact brought up a question saying, is it different that you have difficulty falling asleep vis-a-vis someone who has difficulty staying asleep and probably gets up earlier in the morning? Is that different, or is it the same?
There is a difference here. So the garden variety, we divide insomnia sort of into three pieces, three types, let's call it, for the purposes of describing it. Acute insomnia and chronic insomnia are the surface bifurcation of insomnia, meaning, oh, something happened and for the last week I'm not able to sleep. That's acute insomnia. If it's less than 3 months, we call it short-term insomnia. And then if it lasts more than 3 months, it becomes chronic insomnia. Now, in general, it could be sleep onset type, meaning you lay there in your bed, your partner is sleeping, maybe snoring or already, and here you are staring at the ceiling, at the spinning fan, you're looking at your feed, your social media feed, and sleep is not coming to you. It's been an hour or two, you turn over, look at the clock, it's 2 in the morning, and then you have a 6 a.m. flight or a meeting or something to get up and go with, drop your kids. So that's garden variety sleep onset insomnia. About 70%, you can say, and people will debate over the number, is garden variety insomnia. The second insomnia is sleep maintenance. I fall asleep, okay, doctor, but I get up every hour, every 2 hours. Now that has to be explored a little deeper. Could it be snoring? Could it be a bed partner? Could it be bathroom breaks? Could it be medication that you have prescribed at night, which is doing this, right? Your environment may not be suitable at that point. A train may be running by. Something you've got to explore. Is it an extrinsic or an intrinsic disruption to maintenance of sleep? And the third one, which is the hardest, is I sleep for 4 hours, but then I'm up. I can't go back to sleep. And then I'm just up and I'm tired all day. So those are your three types.
Right. Abhinav, Naveen is saying hello.
Hi, Naveen. How are you?
So moving on to the next set of problems. Some people sleep for hours, and still don't wake up fresh. Why does that happen?
Yes. So that is hinting at a quality problem, right? So you've got your quantity, 7.5. Hopefully that's your number. And whatever this was, the washing machine didn't run well. Look at it like that. Again, it ran, but it was a low quality washing machine, right? It didn't run well.
Right.
So it could be many times we see that in men and women, you may have snoring and breathing interruptions that the individual is not aware of. They may be sleeping for 7 hours. Their brain keeps getting fragmented in micro arousals, as we call it. And 7 hours later, they say, oh my God, they look at the clock. I've slept 7 hours, but I'm still exhausted. My mouth is dry. My head is still hurting. It feels like I never slept. And that could be one reason. Limb movement. Sometimes people will be very restless at night. Their bed partner may be disrupting their sleep. So that has to be investigated a little more. And a good evaluation in a sleep clinic is the easiest way to do this.
Right. So why does one snore? And is that different from sleep apnea?
Yes, so snoring is very common. So historically, we've looked at snoring as a trophy of sleep. Oh my God, Dadaji is snoring. He's in his deep sleep. Don't wake him up, It's associated with deep sleep. So, yes, snoring happens in sleep, but I can tell you after, in 19 years of doing this involved, snoring is never equal to quality sleep. Never. Very few times I use the word never in my life, and never... snoring is never good quality sleep, number one. Number two, it's the vibration of the back of your airway, right? So somewhere here is where the snoring resides. And then the collapse of the airway, and then the oxygen drop, and the brain wave fragments, and then you recover, or you get an elbow from your spouse, or your brain releases adrenaline and you go... All this happens and you have no idea, and you sleep through this, the individual. Snoring, as you saw, was the one component. Sleep apnea was all those 5 things happening over and over, and sleep apnea is linked with heart disease, stroke, and all kinds of other, conditions that we'll discuss in more detail.
So both sleep apnea as well as the basic snoring should be looked into medically and treated. It should not be kind of ignored.
Yes, sure. Chronic snoring, do not ignore the snore no more. We have a campaign. I started a campaign for teaching students here. Ignore the snore no more. Chronic snoring is a problem. Here and there, very tired, had a few extra drinks. Oh, I snored a little more and I'm fine, and here and there is okay. But if it starts to happen chronically in your usual state of health and you're getting elbows to go to the couch, or your spouse is saying, I'm leaving the room because it's too loud, and then you must seek some evaluation, because it's a health risk at that point.
Right. Someone has asked about sleep paralysis.
Yeah.
What is that?
So sleep paralysis is, first of all, very scary for the individual. What is sleep paralysis? It's not a true paralysis as people think about stroke and paralysis, but what it is when you wake up in the morning, half your body is up, but the other half isn't. So you're up, your eyes are open, you want to get up and go to the bathroom and start brushing, but you cannot move your arm or leg. So you feel like a quadriplegic at that point. Your upper arms and your legs are just frozen, and you just cannot lift them, and you think you've had a stroke. So it's basically, what this is that it's pieces of sleep invading into pieces of wake. So imagine a shore, right? If you're on an ocean shore, imagine that the shore is, the beach is wake and the ocean is sleep. Okay, so you're trying to go from sleep to wake, walk from the, like Rithik Roshan walking out of the ocean into the shore, but he's not able to. He's trying to leave the water, but the water keeps pulling him back a little.
Pulling him back.
So he's stuck between sleep and wake, but it's a sign of sleep deprivation. Many times, more commonly, you're not getting enough sleep, so your body is telling you to stay in sleep. It's a signal like, hey, sleep more, you're not getting enough. I'm going to make you scared with sleep paralysis. And many times it could be another sleep disorder called narcolepsy, but again, it requires a quick evaluation, and it's generally benign.
Right. Let's move on to some specific topics. Pregnant women. Most of the pregnant women have sleep issues in pregnancy. I would say almost 70-80% of the women that I deal with pregnant have issues with sleep, either in the first trimester or sometime during their pregnancy. Why does that happen, then?
Yeah, so pregnancy, is again a very magical, complicated, natural process. You're the expert. Before I became a sleep doc and went into this field, my GYN and OB were probably my favorite specialties as well. I have a lot of gynecologists in my family, and they convinced me. They had me brainwashed. That's what the specialty I need to be in, and I was enamored by it, and I still am. So yes, so pregnancy is a great time of kind of not turmoil, but a lot of changes taking place, right, in the woman. So hormones are changing. We have mechanical effects. We have of the growing gravid uterus. We have hormonal changes.
Right.
So these two can interfere with sleep-wake, dysrhythmia, let's call it, right? There's a bit of anxiety involved in pregnancy if you're a primey, if you're first child. So we look at fragmentation of sleep, especially in the second and third trimesters, happens because of that. The gravid uterus will exert some mechanical pressures on, let's say, blood flow return, let's say the bladder, so people get up a little more, so they break their sleep more. We also know that reflux happens. There is some sphincter relaxation with progesterone, so there's acid reflux waking women up. They tend to gain weight. All of us know that, the gravid uterus, the baby, the fluids, and weight gain takes place, and that can increase snoring. Many times you'll realize that in second, third trimester, the woman is snoring more, and that could be sleep apnea developing transiently. So there you have it, right? And progesterone, has a sleep induction effect. So, and there's a lot of progesterone happening in pregnancy, as you know.
Right.
And that's nature's design to try and combat some of this sleep interruption. So nature says, I'm going to give you lots of progesterone when you're pregnant. Hopefully, I'm going to keep you a little more asleep and not interrupted. But sometimes that balance goes off, and the sleep interruptions begin to take place more. And then come external technology. When the women are not sleeping, guess what they're doing, right? They're on a screen, they're scrolling through, and they're reading about not being able to sleep in pregnancy on a screen. and it just compounds the problem. And then you start to plant seeds of insomnia in these women. And it's never good. And yes, folks like you who are aware and progressive understand the importance and can help them.
But the management would really be symptomatic from the problem to the problem, like reflux. We tell them that sleep with two pillows, just prop yourself up, and so on and so forth. Reduce your screen time, things which we will discuss in a bit. But I guess the management would be just those symptomatic things.
Right. And as we hope with all the disorders that come with symptoms with pregnancy, that they sort of will fade when the baby is delivered, right? However, you want to be sure that the bad habits don't germinate. Exactly what you said. Like the habits of, scrolling through at night, because they are going to have a child to take care of for the next 7, 8, 9, 10 months, very intimately. And therefore, right, so nocturia, the GERD, sleeping on the right side sometimes will help in the third trimester because of the, mechanical anatomy
Right.
of it all. And of course, if there's snoring, ask for that. In fact, a cousin of mine, she's in Kenya now, she's a GYN from Bombay. We've talked about this, that not many ask about sleep problems in detail. They'll say, oh, you're not sleeping. Oh, here's something, thanks, bye. Baby will be delivered, everything will be fine. And nobody gets into and sleep apnea with oxygen drops and snoring. If it's happening to a pregnant woman, it can harm the child as well, potentially.
True.
No good large research is available because who's going to do that research, right? So you can't subject pregnant women to known sleep apnea now that you've asked the question and endanger the child. So interesting work. We should do that sometime in your clinic, and we should develop something.
Right. Another segment of women who have sleep problems are the menopausal or perimenopausal women, probably because of the estrogen deprivation. So again, part of the things would be the same, I guess, the cell phones and et cetera, screen time. But is it a good thing to medicate them? I'm not talking about hormone replacement. There are guidelines for that. But how does one deal with them otherwise?
Correct. You said it again. So, more than 60 to 70% of insomnia patients past age 50 are, guess who? Women. And you said it, right? There's a tanking of estrogen, progesterone acutely, and progesterone had some sleep induction and maintenance effects. So what do we do with these women? So correct. So educate them, number one, that they should expect this. Again, plant good sleep rhythms and habits like we'll talk about. Hot flashes, right? So if they are being bothered by these vasomotor symptoms of hot flashes and they wake up at night and now they're awake and scrolling through their feeds or doing things, stressing out, checking time, we must educate them about that too. So there's a little bit of a debate in the field whether it's the insomnia that wakes them up and then they have the hot flash, or is it the hot flash that wakes them up and then they have the insomnia. So it's kind of debated. You ask particular research groups and they'll say, no, it's one over the other. But the bottom line is the jury is still out there. We don't quite know. But the fact is that it happens and we have to address it. Short-term medications may be useful just to tide them over the crisis. Sometimes non-hormonal, medicines like SSRIs have been used to control some of the menopausal symptoms. They can help. And again, all the good, behavioral sleep techniques that you can do to improve their natural sleep drive also help. But it is a big problem. You're right.
Last 1 year, we've not really been traveling, but people travel across the world and jet lags happen. So how is that related to our, rhythm of sleep? And what is your advice as a sleep doctor for jet lag?
So wonderful question. Guess what? Yes, we haven't been traveling, but you and I know once, and I pray that the world gets past this very soon. And signs are that it will, with all the therapeutics and vaccines coming, there will be a lot of travel, right? People are saving up to travel and they want to travel far. So jet lag is an interesting man-made problem, right? So what is jet lag? Just for all your viewers to quickly summarize it, it's when your internal body clock is out of sync of the external clock in the wherever you are. So if you've traveled more than 2 time zones, you're going to experience this sort of jet lag or desynchrony, as we call it. So let's say you flew from Kolkata to, let's say, Paris, or Paris to the US. You've flown, 6-7 time zones apart. That means you will feel hungry at a different time. Your body's, appetite will be dysregulated. You'll feel sleepy at another time, because it takes about 4 or 5 days in a healthy body clock to shape it with the outside clock. And guess what drives this? Sunlight, or light in general. So that's what tunes you, like morning glory, okay? You know the flower morning glory. It opens to the sun and it shuts up when the sun's out. And that's what it will take for your internal body clock to sort of synchronize. The problem with jet lag is this. If you are going to go for a meeting for 3 or 4 days to a new destination, which you are going to experience some jet lag, then it's not worth trying hard to, mend your body clock. But if you're going for a vacation, 10 days to a destination, then it's probably worth it. Or a business meeting that lasts 10 days. How do you do it? So you look at the time zone where you will be and see how far it is. See the day-night sort of sleep-wake timings, and then try and move your sleep times to sort of get closer to the new destination sleep. You may not get it perfectly, but at least start 5 or 6 days in advance to slowly move your clock by about half hour each. And there are apps available for this. They'll calculate all this for you.
Okay.
There's a British Airways app. There is a Fleet Street Clinic app. There is a American Academy of Sleep Medicine has some resources you can tap into to do this. And melatonin can be used as well to help you sleep at the new destination till your body is able to do it itself.
So you're saying this activity should start actually before you even start traveling.
Yes.
That you start conditioning your body slowly, short time kind of things, so that by the time you reach there, you're already half conditioned.
Yes, you get it. That's the right word, half conditioned. You don't want to be perfect. You just want to be closer. Right. That's all.
Right. There are now these various apps which are available to help you sleep. Calm, and Bose has these ear pods which you can plug in and you can actually sleep with them, and there's some calming music going on and stuff like that. Do they work? Are they effective?
Correct. So they address a small piece of the puzzle. I'm not saying that they don't, but they do address a small piece of the puzzle, which is anchoring the mind. So why you cannot sleep easily for those who don't is that their mind is sort of busy. Their body is ready, the mind is busy. It's like you're in a plane ready to take off from the airport, but you're 17th in line, So you're sitting buckled, right? But you're not taking off because there are 16 planes ahead of you, or you're doing different things in your mind. Oh, you're thinking about this, you're thinking about that. You have a screen. You're waiting for takeoff. You're trying, right? You're trying. Nobody sleeps better by trying harder. This is the second time I'm using the line.
Right.
You have to let sleep come to you. So when we talk about these apps and these the audio stuff, I have no problem with. Okay, the audio stuff I have no problem. Like the Calm, Headspace. I've done some panel discussions with folks at Headspace, and Calm is a liked app. All it's doing is it's anchoring your mind, right? So imagine your mind to be a little hummingbird. It's flying. But these apps sort of make you pranayama, breathing, yoga, just meditative relaxation. All it is, you're anchoring the mind and you're letting sleep come to you. So they do help. If you can form a good habit out of it, they do help. So short answer, yes, they will help if you set the other things in place as well.
Right. So is going to the gym in the evening harmful for sleep?
Good question. Vigorous exercise. When I say vigorous, I mean your heart rate is at the 120, 125 for a good 30 minutes. You're sweating, you're lifting weights. That may be counterproductive. So when gyms are open at 10, 11 at night, I worry. I cringe a little bit when I'm driving through the country or wherever. Oh, yeah, I'm going to build muscle at 10 at night. I don't think it's a good idea. And then you want to come home and crash into sleep. There's too much of a cortisol, adrenaline rev that takes a little bit to cool off. It's like taking your car for an oil change to the dealership, right? Or to the service guy. When you pull your car in, is he straight going to the engine and putting new oil in? No. What does he do? He opens the hood and he lets the engine cool down. Right. So that's what you have to give yourself a little bit of a prep time. And vigorous exercise is not good, but I will say that stretching and light exercises, like, maybe some yoga, basic postures, maybe some basic stretching is actually shown to be a little helpful. It does relax some of the muscles.
Okay. We keep hearing about, as you said, screen time and the blue light from these devices.
Yeah.
And they actually cause problems with sleep. Is that true?
Yes. So I have a little bit of a fun anecdote here. So bright blue screens are a blue-green light spectrum is known to suppress your own melatonin via your eyes, right? So like the ear has two functions. The most common one that people feel is hearing things, right? And the other function that the ear has, and this, is balance. So, and the eyes have two functions too. Guess what? The first function is what you're using right now to see us through the screen, which is vision. And the second function is sleep-wake synchrony or regulation, because they sense light. Even blind folk actually have sensors that will tell them that it's time for wake and sleep based on light sensing. So when you put a lot of light in the evening hours in your eyes, that suppresses your natural sleep-wake rhythm by suppressing your own hormone called melatonin. So guess what? So we invented the brightest blue screen that is going to help you sleep. You want to see it? I have it on premiere display with Dr. Rajeev. Are you ready for this? This is our premium blue screen. So it's blue in color. So once you do that, yes, so the short answer is yes. Avoiding bright lights, especially in the blue-green spectrum, will help in the evenings to an extent. And exposing yourself may delay sleep onset and make matters worse.
But you said something very interesting. I mean, something that even I wasn't aware of, that those who are blind can still sense light. I mean, how
Correct.
else would they sleep at the right time and get up at the right time, kind of a thing?
Yes, absolutely. It's a proven fact.
Is coffee really bad for sleep? A. B. Is tea just as bad? And if bad, then is there a right time for drinking coffee or when not to drink coffee?
Correct. So a cup like this, and remember, for your viewers, it's about 10 a.m. where I am, so I can do this, but you shouldn't. So a cup like this will have about 100 milligrams of caffeine. Caffeine is probably the most used stimulant in the world. Caffeine has a 6-hour half-life, meaning, so I drink this cup now, about half of it is still there 6 hours later in my system. And let's say 8 a.m. I have a cup, so about half of it is still there at 2 p.m. And then a quarter of that cup is still sort of lingering in my system at 8 p.m. So think about it, right?
Okay.
If you have problems sleeping and you chugged a big drink of, a soft drink with caffeine or a big piece of chocolate, it may disrupt your sleep. For those, so I say, if you're having trouble with sleep, it's a good time to cut off caffeine somewhere around noon or 1, even earlier maybe.
Okay.
So have your morning cup, maybe 10, 11, and then cut it. Tea usually has less caffeine in it than coffee per se. Black coffee obviously is concentrated. So, and portion sizes here are a little large in the States of generally things. So you may be getting lots of caffeine. It's a culture thing as well. Indians love their tea a little more than coffee. So you watch for the timing if it's bothersome, and that's going to be important for you if you have.
Again, something very interesting. You said that when normally people say I shouldn't have a cup of coffee when I'm trying to go to sleep, they usually mean post dinner I should not have a cup of coffee. But what you're saying is if they have difficulty sleeping, 12 midday or maybe sometime after that is when they should have their last cup of coffee.
That's
if
right.
they really want to sleep well at night, you can't have a cup of coffee at 5 and 6 and disregard that, saying that really wasn't at bedtime.
Correct. You're right. 100%. You said it. So, and luckily the cups in India are very beautiful and ornate and small at the same time. So nobody is drinking, this much at 5 p.m. So that's probably a protective cultural piece. But you're right. 5 p.m. Stopping your coffee at 6 p.m. in hopes of sleeping better is not the best idea. You're probably late on the bus. The bus left at 12 p.m.
Someone has asked about pranayama and sleep, and I think you already answered that it definitely helps if you do kind of these yogic exercises and so on and so forth.
100%. Please continue to do them. Please continue to do them. I wish we could get large-scale research to fund pranayama and sleep, but they're all about anchoring the mind and lowering the sympathetic drive in the body and increasing your parasympathetic drive, which is more sort of relaxing and calming. Yes, next.
Are sleeping pills really that bad?
Oh, controversial topic, right? Here is a sleep medicine doctor, and he's now been asked the most sensitive question. And true to the field and true to the science, short-term use is probably okay. Okay, so imagine a child trying to learn to ride a bicycle. Let's go back here for a quick second. So what do? We put on some training wheels, right? Those extra wheels, so that what does it do? Does it ride the bike for the child? No, it helps them not fall while they are learning. And that's how I teach all my patients and friends and everybody. Like, sleeping pills help, but don't rely on them to push the bicycle. You have to do it. You have to regain that behavior, remove the detrimental behaviors that you're subconsciously or unknowingly doing, and then get back into the rhythm. It's like building muscles in a gym, right? So you're not going to build muscles in 2 days. If you go there 3, 4, 5, 6 weeks, then you'll start to feel better. And that's what sleeping pills are. Sleeping pills are, I'm going to have this pill and I'm sleeping fine. It's like building muscles in a day. It's not going to happen.
Right. And we know that those who start taking sleeping pills take a small dose of it. And with time, the dosage only keeps increasing because that small dose doesn't become effective for them in the long run. And the amount just keeps increasing.
Because it doesn't address the root of the problem. It puts a blanket over the fire. It doesn't turn the fire off. It puts a blanket. It helps them. And acutely, I have nothing against it. if you're having so much, but you have to have a behavioral plan in place as well and be true to it. Be
Right.
true to it. Like
Okay.
with, yeah,
From a layperson perspective,
yeah.
melatonin is there in my body. Melatonin is secreted every night, and it tells me that this is the right time to sleep. Can I take a small extra dose of melatonin every night, and that helps me sleep well on a regular basis? Would that be all right?
You said the key word there is regular basis. So if you need anything to sleep on a regular basis, then it's time to ask yourself, like, if I didn't have this, what's going to happen? Am I not going to sleep? And am I going to be
Right.
miserable the next day? And then it's time to have a chat. But you're right. If there is a phase, let's say a week or two, deadlines, you're stressed, the project, then maybe it's okay. Okay, maybe it's okay under the guidance of your GP, your practitioner, your sleep doctor, somebody guiding you through this. But you should have an end game in place. Because
Right.
sleep, like eating, is natural and pre-programmed, right? So you never needed anything to sleep when you were a child. Why now? Like, what happened now? It's such a
Right.
fundamental natural process that the body requires for 1/3 of your life. If you need something to help you along, why are you needing this wheelchair or a crutch every night? You shouldn't.
Right.
So talk to someone about it.
So, in fact, someone asked that, because of the pandemic and COVID and everything else, some people have gone on to taking melatonin and anti-anxiety medications or sleep medications during this period of time because they're anxious. And how does one get off it? Of course, the answer, should one get off it? You've already given, they have to get off it. Easier said than done. How should one do that?
Yeah, there should be a plan in place. I'm not for one who wants to pull the plug and say, okay, deal with it. You'll be miserable for a week or two and get over it. I'm not that sort of a drill sergeant, headmaster kind of an approach. I sort of tailor
Right.
my approach to see where the individual is at this point in their journey. Are they ready? Are they not? What is
Right.
motivating them to see me? By the time they are seeing me, they're generally sort of somewhat ready to say, you know what, sleep with medicines is like processed sleep. It's not your natural. It does interfere. Every sleeping pill at some level will interfere with your natural washing machine cycles of sleep. Natural sleeping cycles are altered by whether you talk about Valium, prescription medicine, supplements. They somehow interfere with your sleep to some extent.
Right.
So you're not getting the best quality. Then how do you get off? If you have a plan in place, you try to put, and this is research published in JAMA about 12, 13 years ago, that sleeping pills plus behavioral treatments, you start, and in about 6 months, you withdraw the pills slowly, and then the behavioral treatments will in perpetuity sort of keep the problem solved for about 80+% of people, it's a high number, right? So, and that's the plan they should have in place. Speak with someone, speak with a trained clinician about this to help you with your journey to regain your sleep.
Right. Something which is now, becoming more common. It was common in the US. Now the medicinal component is coming into India as well. THC, extract from weed, being used medicinally. And I was looking up somewhere where they said that THC could be used for insomnia. Is that allowed? Is that good? Can that be used?
Yes, and we've done some, again, discussions over this and some articles and so forth. So there are certain, half the states, something like that in the US have this legal, the others don't. There are extracts. CBD is an extract of THC, which is the active compound. They may again help for short term, but long term THC, large scale studies are still missing. They're not there yet. But what we've learned so far is that long term, it's not a good thing. It will interfere with cognition. It will interfere with the amount of deep sleep you get versus not. So again, long term, nobody's surprised at the answer that anything that you use to sleep, short term may be okay, but get the house in order in that time.
Right.
It's the training wheel concept. Remove the training wheel after you've learned how to ride the bike. Nobody rides the scooter with 4 wheels till the end of time, right? So THC, yes, barring the dangers, is a good short-term idea, not a good long-term fix, in my opinion.
Right. Our friend Naveen has a very interesting question.
Yes, Naveen.
Does controlled drinking of liquor lead to better sleep? So, and he loves his beers. So small amount being consumed every day, we know that probably it helps you sleep as vis-a-vis large amounts of alcohol. Is that a good idea if someone takes it on a regular basis?
I love this question. I get it all the time. And my good friend Sunalini Matthew, who writes for The Hindu, we did a series, last year. And this was the most loved question of them all. Alcohol and sleep. Oh, I don't take my wine glass away. It helps me sleep. So there are three-part answers to this, Naveen. The first part you'll enjoy. Nobody in the world can say, I had 6 shots of whatever Dr. Singh. I feel great today. I had 6 shots of tequila last night. I'm feeling awesome today. You will never find that person because there doesn't exist one, right? Because it's just not there. They're lying to you. Second, small amount. So what is small amount, right? So small is a very variable adjective, depends on who you're talking to. Is small one large peg? Is small a medium? So there's a variability in small. And I've written an article for the Sleep Foundation on alcohol and sleep, so you can see that. Small amounts, about 3 hours. So your last drink, if it's about 3 hours away from your getting into bedtime, 2 or 3, at least 3, some people will say 4, then you'll sleep. Then the interference of that alcohol breakdown is less on sleep. That's point number 1. Point 2, if you're closer than that and you do have a drink, it may help you fall asleep quicker. So your sleep latency or time to falling asleep may seem shorter, but it comes with baggage. And this is the baggage. You may snore loudly that night. Your sleep is not as deep and cycling through as efficiently. And in the second half of the night, the metabolic breakdown products of alcohol, while your liver is trying to break them down, act like darts into your brain. So they keep sort of fragmenting your sleep, and you will wake up with a little, yeah, my mouth is dry, I didn't feel that great. Again, alcohol acts on the same place in the brain where Valium acts. Same place.
Okay.
So that's why the dependence comes with Valium. That's why the dependence comes with alcohol. So it's very similar how they act. So therefore, yes, Naveen, you can have your small bira, but keep it 3 hours before sleep. That's what I have to tell you.
Someone needs help with snoring. So you'll probably have to, I know it's a vast thing. You can't help them right now online, but in a short sentence, what is your advice to them?
Yes. So if you're snoring loudly and you're being told by your spouse that it's bothering someone else and you are feeling dry mouth and tired, you should get it looked at. What can you do? Yes, losing weight, sleeping on your side more than your back, making sure your nasal passages are clear, you don't have any blockages or allergies, heavy drinking. So don't hang out with Naveen too late at night. So reducing alcohol, sleeping enough quantities. These are easy things to do to possibly reduce your snoring. Certain breathing exercises like Kapalbhatis, and there is one that my father talks about called Ujjayi. It tends to sort of stiffen your muscles at the back of your throat. Playing a wind instrument like shehnai or trumpet, that interests you, can tighten up some of the muscles and may reduce snoring to an extent. But if you're trying all this and it's still bothersome, it's time to get it checked. And don't ignore it for too long.
Does smoking affect sleep?
Yes, adversely. Short answer. Smoking inflames the back of your throat, makes all the soft tissue structures swell, and it causes more snoring. And also the nicotine itself is a stimulant, so it keeps fragmenting your sleep. Like potholes on the road, right? Everybody on this channel should know what potholes on a road are. It's like you're hitting potholes every time on the road with sleep fragmentation, hurting the car.
What is the time difference which should be there between, say, dinner and sleeping? Does that also affect sleep? And also, say, you spoke about pranayam. Is there, again, when should pranayam be done if you want to sleep better at night?
That's a tough question. Well, that's not a tough question. It's a good question. So meals and sleep, if you can keep your meals 3 hours away from sleep, and I know all my Indian brothers and sisters and friends are going to scream at me after this, and I'm getting a lot like, how can you do this? This is our culture. We eat at 10 p.m. and we have dessert at 10:30 and chai at 11, and then we head to bed. Hopefully that's changing. But at least 2 to 3 hours after your final meal should be your sleep time. So to allow some gastric transit to happen, food to move onward, and to help you sleep. The other question was, what is the timing and dosage of pranayama? I don't think it's been determined scientifically, but if you have a routine an hour before you go to sleep and you can incorporate that pranayama into the last sort of 20 minutes or 15 minutes before you actually close, and we can talk about that if this is a good time, or we can get to the question. That's the time you can introduce a bit 10-15 minutes of pranayama and let sleep come to you.
Right. Nandini's asked, some of us don't have a problem falling asleep, but we have a problem staying asleep. You've already answered that question.
Yeah.
Nandini, you could probably go back and look at the video. It's already there. Shivani's asked, is segmented sleep advisable for children? What is the ideal number of hours for a 6 to 7-year-old?
Yes, so good question. So 6 to 7-year-old by then should have lost their naps. So kids don't need naps after about 4 or 5 years of age. If you go to the National Sleep Foundation website, Nandini, I did a piece which talks about hours and sleep at different ages. And if you go and look there, you'll find somewhere for a 7-year-old, you're looking at somewhere around 10 odd hours of sleep is healthy. Plus or minus, and every child will vary a little bit. So if the behavior is cranky, they hard time getting up in the morning, then they're telling you that they probably need a little more sleep and need to go to bed a little earlier. So try and play with that, but I think 10 hours is a decent place for a 7-year-old.
Okay. Someone has asked, how does one take care of difficult, distressing dreams?
Yeah. So difficult, distressing dreams, if they are recurrent over and over, there are two things you can do. The first piece is there's probably some underlying stress that is being translated into these dreams. So that's the first piece. That is your part of the puzzle to solve. I can't help you with the particular stressful environment. Your bad boss is your bad boss. But what I can tell you is if you're having a recurrent stressful dream, what we call image rehearsal therapy. So what I tell my patients is write the dream out in the daytime. Like take a book like this and write it out. And then change the negative parts of it into positive parts of it. So keep 80% of the screenplay the same, but change the ending, like rewrite the script a bit, write it down, and then like read it to yourself again. And that you're planting in your subconscious to hopefully take the place of the distressing dream sequence. And you probably will do okay after a while. The good part will start to replay now in your head in that dream.
Right. Someone has asked, does surgery help with snoring? And if you're on that topic, and because we have a little bit of a time, would you like to just talk about CPAP as well?
Oh, everything. So snoring, yes, there are certain surgeries that may help with snoring. So in the 1990s, we used to do a lot of surgeries for snoring and sleep apnea. They would cut the soft palate, shave off the side wall, burn the tongue. These are very sort of intense, involved surgeries, but they don't hold long term. That's the other problem.
Right.
So maybe in 20-30% of them, they may work, but for the most part, the snoring is going to come back. So not the first line treatment is the answer to that. If you have, tonsils in children, snoring can be treated with tonsillectomy, adenoidectomy. So oftentimes the ENT will do a sleep study, say, oh yeah, look, there's sleep apnea and snoring. And the next question I saw pop up was, can it bother a child's brain development? And the short answer is yes, it can, if the child is sleeping poorly quality-wise with snoring. So for a child, surgery, tonsillectomy, adenoidectomy. For adults, not so much, not the first line. Then what do we do? CPAP, you wanted me to touch on CPAP. So CPAP stands for continuous positive airway pressure. It's the sort of the gold standard device. It's 40 years since invention from the 80s. And it attaches a little bit of air pressure through a mask and keeps your airway from, this is snoring and vibrating, and CPAP, sort of it stays open like that. These are, there are 100 different masks available. Not everybody is getting a fighter pilot mask. So talk to your doctor about it. The technology has improved vastly for this.
Right. In fact, I must give you a compliment. A colleague of mine, Dr. Apurva, had mentioned that that's the best snoring that you could have given, your voice and your hand movements.
Well,
best snoring example.
Thank you.
So someone has written, so in the evening, should we put off the tube lights and switch on yellow light?
Oh, good question. Good question. Very good. I love that question. Thank you for asking that. There were some colleagues, I think, up on the East Coast that did a little study, and also in Europe, that they found that in the last 10 to 15 years, our evenings are 40% brighter than they used to be 100 years ago. Check that out. 40% brighter than they used to be 100 years ago. Why? Because of the illumination that we have now. Cheaper LEDs, brighter LEDs, white. Everybody loves white light. Remember, white light is full spectrum. Right. It has all the frequencies, including green and blue, that do tend to suppress sleep. And that yellow light is more on the red side of the spectrum, right? So it's warmer, it's softer. 100%. Dim your lights, make them yellow. Easy answer. Do it. So, fantastic. Agree with you.
So what about nursing? I think this is the last question we can take. What about nursing mothers? Sleep is disturbed and we have to wake up 3 to 4 times even if you don't want to.
Yes, very good.
I don't know how you'll help.
I had a colleague yesterday at an event that we were talking. She has an infant now who's about 7 months old, and the infant is sleeping fine. So we talked about it. So in children, in newborns, they will cry, right? Why will they cry? Because they're hungry. They only do two things, right? Dr. Agarwal, the newborns either eat or sleep, right?
Yes.
And that's how fundamental sleep and how beautiful sleep is. So when they're hungry, they'll want food. Now, after about 3 months, physiologically, they have grown enough to hold enough food to not have a sugar dip, meaning like not have hypoglycemia, to wake them up. So after 3 months, if your child is waking you up for feeding or just waking up, then it's just fun for the child and it's pain for you. So physiologically, they should not wake up in the middle of the night, at 2, 3 a.m. after about 3 to 4 months. So you have to train yourself and the child at that point. Don't feed them. Because if you feed them, you're perpetuating a behavior that the child enjoys. So why wouldn't I? If somebody came and played with me at 2 in the morning, as a child, why would I say no to that? So you've got to let that extinguish that behavior. And eventually, after age 1, they will do okay, and the mothers will go back to a continuous sleeping routine, and they'll do fine.
Right. Thank you. We are nearing 1 hour, and we have to stop before that, otherwise the video doesn't get saved. Thanks a ton for doing this with me. But as we discussed, we have to come back and do a full podcast on this, because this 1 hour doesn't do justice to the kind of sleep and the depths of it that we need to actually discover. Thank you so much for doing this.
I had a great time. Thank you to all your viewers. And please get your questions poured in, and we'll try and answer this at another live event or a podcast.
Right. Take care.
Sleep well.
Have a good day.
Take care. Bye now.
Thanks. Bye.